Welcome. I'm Dr. Roxanne George. I'm your host today for the Radiant Health Dialogue series on breast cancer as part of HippocratesDocs.com. We are excited to offer you this valuable information to empower you to have radiant health now and in the future. I am so excited to be talking to Dr. Christina Miller today about stress and how it can influence breast cancer. Welcome, Dr. Christina Miller. How you
Thank
doing?
you. So good to be here.
So we're so excited to have you. We have a lot of questions, but if you want to start off by just sharing with us your journey and the effects you've seen with having patients on a plant-based diet, that would be fantastic.
Sure, thank you. So I am trained in emergency medicine and was working in the ER, and I started having my own autoimmune issues, joint swelling and pain, and I'd seen so much autoimmune and all these inflammatory and chronic issues in the ER, and then it was happening to me. And so I had gone on medications and wasn't getting better and was feeling very scared and extremely stressed at this point. So to preface what we're going to be talking about, I was under a lot of stress, and when I got sick, it all intensified. So chronic illness is a huge stressor, and so that's what was happening to me. And I felt like I was hopeless, and this is 10 years ago now, so I didn't know about plant-based diets or diet or anything. And so I then started doing some research and came up with the impact of diet and nutrition on our immune systems. And so I overhauled and changed my diet, did a completely 180 after I learned all of this, and went plant-based and never went back. So this is 10 years, almost just about 10 years ago now that I made the switch. And I started sharing it with my patients, of course, because I was so excited and I got better and better myself. Although there was a delay, which I'm going to get to a little bit later, but I was getting better. And so I started sharing with my patients. They would come into the ER and I would say, well, what do you eat? And I would always want to know, and we would address that, right? If they were getting sick frequently, if they were having gut issues, if they had asthma, if they were having high blood pressure, if they had a heart attack, right? I was kind of addressing and saying, here's information, we can talk about it afterwards, or when you get better, we'll do our job to help you now, then you're going to do your job to improve this in the future. And since then, I have started my own practice and I started doing lifestyle medicine, and it was tremendous. It's been so much fun working with patients. I've been doing this for now about 8 years, and now I actually work with telemedicine, doing plant-based. I work with plantbasedtelemedicine.com, where we do it into people's homes all across the country, and it's so much fun. And my patients are making just tremendous improvements, and because we're in each other's houses, we're able to stay in touch quite a bit, and I can see them improving, and it's been so much fun.
Oh, I bet. I love the gratification. The reason we all went into medicine was to heal people, and it's great to, that you're getting to see that firsthand, through all your practice and your patients. So let's get into our topic today. So stress and breast cancer, the mind-body connection. What is the connection really between stress and breast cancer that you've seen most, vividly?
Well, several things that I would like to address. First of all, like what I just touched on, was when someone gets diagnosed with a chronic illness, so cancer, right, the big C, it doesn't get too much scarier than that. So when you hear those words, you almost don't hear anything else. And immediately your frontal lobe is thinking of what's going on, and it's sending it to the back of your lobe, to your hippocampus, which is going to flood your body with over 100 hormones released from other places throughout your body, to your adrenals, to your insulin, throughout your whole body. 100 or so different hormones are released right away. The vagus nerve right away, which is going to our whole bodies, to our hearts, to our guts, to our livers, to our lungs, right? This right away is changing, and it shifts. And what we're finding now is there's even a shift in the microbiome. So we're finding all sorts of things that are happening because of our stressful thoughts. And the reason it's so important with things like breast cancer is people are really struggling, right? And it can be so tremendous, and difficulty sleeping and change in mood and depression and severe anxiety, right? I know this from my own illness that I had so much anxiety and so much depression. It was like this weight was on my shoulders 24/7. It never went away. I could not get rid of it, and it delayed my healing. You can't just drink a million green smoothies. I've learned you won't heal if you don't deal with what's going on in your head. It's just as inflammatory as the foods that I had previously been eating. And so it can also help support the immune system. It's been shown to significantly support the immune system. And now there's been some recent data that have showed not that it's a causation, stress does not cause breast cancer, but by increasing inflammation, it can potentially worsen it. And people who are under a high amount of stress, when they went back and looked at them, those under a high amount of stress tend to have more aggressive forms of cancer or more progressed. So getting stress under control, it's beginning to look like it actually does play a more significant role than they had thought, in addition to all the effects of having cancer that it helps us with.
Right. And I think it's important to remember that balance. We do what we can on our nutrition side, and then, our mental health side. And, it's not necessarily, we can't just focus on one piece of the puzzle, so to speak.
Absolutely. And with all of my patients, I work on them, no matter what they come in with a diet plan, and then with a mind-body plan, right? We all have to be addressing our stress, and it's really important. And I give them homework in it, and I check up on it. And so those really working on their mind-body have a much faster healing. They just progress so much faster. It's amazing the power of our minds.
Right. Do you think that's where the group therapy, there has been studies that showed cancer survivors that are in groups, when they're talking about, having that kind of support, is that probably part of it as well?
That's absolutely a part of it. And the group therapy has so many benefits because it's, you release the feel-good hormones by being with others. Connecting is going to do such that's a whole nother category right there. And some of your feel-good hormones like serotonin and oxytocin and GABA to relax you, that's all going to go up when you're connecting with others, being supported. And yes, stress goes down. So it's going to have a big effect.
Great. So talk to me a little bit about that happy medium, because sometimes a little bit of stress is good, too much stress is bad. So is it true a little bit of stress is good?
That's a good point, because then people start to think, well, all stress is bad, right? But we actually need stress to live, because I always say, like, imagine you're on a beach and it's beautiful, right? And there's nothing going on. There's no coronavirus. You have plenty of money. You have good health, right? It's sunny every day and 80 degrees, and you're sitting there at the beach, right? Perfect. And you're there day after day after day after day after day after day, and week after week and month after month. And you don't have any challenges. You don't have any projects. You have nothing to, it's a challenge that you show how great you are, your character, you become a better person, right? And you feel good about yourself after you have a challenge. So without that challenge, that's not good either. So good stress is stress that gets you to your peak performance, and that's called eustress, EU stress. Eustress gets you to that peak performance, where if I know I have something going on and I'm going to wake up early because I'm excited and I get to work on it, I feel motivated all day and I'm focused and I work on my project and it feels great and I get it done and I am so happy. That's eustress, right? But there's a point where we go over that eustress, and that's where we start to get in trouble. And that's when maybe I'm working on this great project, I'm so happy, and then I get emails about other things I have to work on, and then something else goes wrong, and then there's a family crisis. And next thing I know, I'm like, oh my God, I don't have time to do all of this. And now it's due. And now that good stress is tipped over. If it's acute, so it happens in the short run, we're meant to handle acute stress, right? Our bodies can deal with that. And I can do some of the techniques we're going to talk about later on to improve that. But if the stress keeps going, where it just keeps going and it keeps accumulating, and some of these are like financial concerns or a sick parent, right? Or a sick kid, a divorce, and a loss of a family member, right? With coronavirus, I mean, so many horrible things happening right now. And so some of these are going to be chronic stressors. You can't get rid of them. And so we're going to talk about some tips that we can do for that. But that stress is actually shown to suppress your immune system. And it directly changes the hormones that are released, the vagus nerve. It changes the microbiome and what they're doing down there in your gut. and it has profound effects on your body if we don't figure out a way to get that under control. And we'll talk more about some of the things that it can do.
Yeah, and how do you reach out to, or how do you help your patients sort of, decipher that point, that sort of tipping point, because they're gonna, in theory, be like, Dr. Miller, I can't control these external stress factors, so, what stops me from throwing my hands up in the air and being like, I can't change it, so I'm just gonna wallow in self-pity and spiral. How do you buffer that or help them with that?
It's interesting. Some people realize that they're under a ton of stress and they'll say it right away. I'm so stressed out. I feel that I need help with this. And others will just say, well, how's your stress level? And people say, oh, it's just normal. I'm always at this level, right? So people are living at a high stress. We don't even think anything of it. It's kind of common in our dialogue to be like, oh, I'm so busy. Oh, I'm so stressed. How are you doing? Oh, I'm so stressed. And I tell my patients, as soon as I hear those words, I'm so stressed out. That tells me we got to work on this. That's not right. We should be living in this state, and then something happens, and we have that, and we deal with it, and we get back down, right? So some people are out there. So with everybody though, I do mostly by talking to people. I can start to figure out if it's no longer a eustress that got them to the peak, and now they're kind of tipping over. And things like a cancer diagnosis, right? That's often a thing that will tip someone over into now it's too much stress to handle, or they're going to need the techniques. And there's a lot of techniques that we're going to talk about that have real science proven to help lower people's stress and get them back into a healthy stress range where they feel productive again, even with things happening in this world, right? And so that's the fun part that is exciting to talk about. Once we understand what stress is doing to our bodies, how it's slowing our gut function, how it's causing severe anxiety and depression, how it leads to autoimmune diseases, and it contributes to heart attacks. And there's actually a syndrome called it's a syndrome where someone is thinking thoughts, so something really bad happens, and it goes to their heart, and they actually it sends so much of the nervous system to the heart that it actually stops, and it goes into acute heart failure. And it's a Japanese term for octopus because it looks like the octopus. It's called takayatsu. And it's a real syndrome that I've seen in the ER, and it's usually when someone's loved one dies or they hear really bad news like a cancer diagnosis, and it's extreme, and it's pretty rare, but it's frequent enough. I've seen it a couple of times in my career already. But what's so interesting about it is it's showing the mind-body connection, that just having those negative thoughts can go right to your heart and lead to that. So once we realize that that's something triggering people, that it's not normal to have that stress, then that's where we jump into action.
So yeah, and how do you work with your patients on flipping that perception, or working with that view of stress? What tools and sort of hands-on things are you doing to help them?
So there's a lot of really good things that is evidence supported, and for me, I'm an evidence supported physician, so it's interesting to think, oh yeah, that might help. But as I started delving into it and really studying it, I couldn't believe that for so many years we know this. And so here's one good example. If you go to a doctor and you get a blood pressure checked and say it's a little bit elevated, so many of my patients say what? White coat hypertension, right? They say this to me all the time. It's white coat hypertension, doctor. And I say, first of all, I'm not wearing a white coat, and I'm not scary. So, that they can't blame it on that. But, it's such a common thing. We don't think anything of it. But here's the thought. If your thoughts when you are at the doctor's office that you're worried and you're anxious, which I understand that completely, and that stress of being at the doctor's office leads to elevated blood pressure, that is showing a physiological force factor that's happening when you're due to your thoughts. And so there's a cardiologist at Harvard in 1975 named Dr. Herbert Benson, who realized that if things like stress raise your blood pressure and cause physiological changes, can relaxing do the opposite and lower it? So he coined the term the relaxation response. And he found that when people did a mindfulness activity, and I'll tell you exactly what they did, that they were able to lower their blood pressure, lower their heart rates, and he did blood work on them. They lowered their inflammatory markers like CRP and their SED rate. They came down dramatically, as well as other metabolic parameters in their blood. Even their cholesterol over time lowered just by dealing with their stress. And so this is documented. It's all in papers since 1975. And since then, there has been an explosion of data about mindfulness techniques and how it lengthens telomeres. And telomeres are the ends of your genes, and they start to get unraveled and kind of disintegrate as we age. And that leads to mutations and mistakes in replication, which can lead to things like cancer or other problems down the road. And it shortens our lifespan by having these ratty telomeres. And people who meditated and who practiced mindfulness actually had longer telomeres and more telomerase, which is the enzyme that lengthens it. So fascinating, right? So some of the techniques, so being aware of this, being so aware of what it does and how much it's helped myself, and seeing it in so many patients. Oh gosh, so many patients that I've had have gone plant-based and are struggling and they're not getting the results, right? And we're working on it. And it wasn't until I started teaching these techniques that I saw them make remarkable changes. So some of my favorite ones, I mean, there's so many techniques you can do.
Yes, I was just going to say, let's get into the techniques. I'm excited.
There's so many you can do. And the important thing is there's something different for everyone. There's not one right thing. What works for me and what I love is not what worked for my patients this morning and the patient before that and the patient before that, right? We have different things, and it should be personalized for you, what speaks to you, right? So some of my favorites are simple breath work. So breathing in slowly and breathing out slowly. And I'd like to think of it like a sine wave. You breathe in slowly and you breathe out slowly. And you breathe in and you breathe out. And you breathe in the goal is to breathe in for at least 5 counts in. So breathe in for 5, 4, 5, and out 2, 3. So you're just counting. And you're kind of picturing, and I'm doing this on purpose, I'm picturing a smooth wave, because as we breathe in that slowly and we breathe out that slowly, 5. And if we do it 6 times, in for 5, out for 5, that's 1 minute. So 6 times, that's 1 minute. That's all we're asking for. In just that time, it's been shown with heart rate variability that it starts to bring your breath in line with your heart, in line with your brain, with all the nerves. They start syncing. You go into synchronization in your body. And that alone can start to lower your blood pressure, to start to decrease inflammatory markers. And it doesn't take very long, right? So I recommend that patients do minimum of 2 times a day, a minute in the morning and a minute in the evening, and anytime during the day if they need it. And for me, if I finish working with cases or if it's stressful, something's going on, I'll sit there and do a round myself. And I always feel better too. And then you can do more advanced breath work where you actually breathe out longer than you breathe in. So you breathe in for like 4 counts, 1, 2, 3, 4, and you hold it for the count of 7, and then you breathe out for the count of 8. So it's a much longer exhalation. And this was kind of figured out. It's an Ayurvedic type of breath work that's been used for thousands of years. And Dr. Andrew Weil teaches a lot of this. And there's actually data for this, that with the longer exhalation, as you breathe out, you trigger your vagus nerve more. And the vagus nerve is the rest and repair and restore. It's the one that helps with digestion, that calms all of our nerves. So the longer we can exhale, the more vagus nerve we tap into. And so that one, you breathe in for 4, you hold for 7, you breathe out for 8. And ideally, you're breathing in through your nose and out through your mouth. And you do it 4 times. You're blowing off the extra CO2, your extra carbon dioxide, so you can get a little lightheaded. So you can start with 2 rounds. You can always start sitting down. Don't do it when you're driving. It will relax you, and it's the opposite of an anxiolytic, a medicine, or an antidepressant, because the more you use it, the more effective it becomes. So I recommend 4 rounds as your goal, to do that 2 times a day. So you could do either one. You could play with what speaks to you. These are both evidence-supported techniques for breath work. So that's my first one that I love, and I recommend everybody do that, because everybody has time, right? Nobody can say, oh, I'm too busy. We have a minute. So that's one. This another one that I personally love that not everybody does, but is yoga. So there is significant data, excuse me, people with joint pains and arthritis of all types, whether it's rheumatoid arthritis, whether it's another autoimmune type of arthritis, or even osteoarthritis. They start doing yoga for 8 weeks, 3 times a day. 3 times a day, 3 times a week, for about 40 minutes to an hour. And all of them reported decreased in pain. And they, when they did the studies looking at their inflammatory markers, had a decrease in inflammatory markers, decrease in cortisol levels. Numbers just started coming down. And so, and 100% it reported improvement in pain of their joint pains. So when I saw this data, I was having joint pains. And so I started doing yoga, which I had never done. I was never interested. It wasn't my thing at all. And I started doing it. And it wasn't that fun at the beginning, I'm not going to lie. But as I started doing it, you're focused on one thing, these positions. You're deepening your breathing. So your other worries you're letting go of them because you have to stay mindful. You're in the moment, you're present, you're focusing. So many things is tapping into your brain. Plus you're moving and you're stretching, you're getting energy moving through your body, and you're lubricating your joints by doing some of these poses. And you can start real simple. There's simple yoga for healing. There's ones they're called restorative yoga with essential oils, all sorts of different yogas. You can do them. I now do them online at home. YouTube videos, you can get free yoga all over. So yoga, and I certainly feel better. If I don't go to yoga, I'm stiff and I can get joint pain. So it really does help. And my patients, I have most of them, if they're interested, I introduce the concept and have them playing with that. So that's the second one.
And that you get the 2-in-1. You get the mindful aspect as well as, the stretching and exercise and trying to, move your body. So
right, and you actually get 3-in-1 because you're also getting the breath work in there too. So you're tapping into your vagus nerve, so even more. And it's even people like me who don't know what we're doing. And they showed yoga newbies that they had initially, they had shorter telomeres. And again, after, I can't remember how long it was. I think it was a 3-month program. They had longer telomeres. So it also plays a role. I mean, it's amazing just doing that. And then, so that's the second one that I love. A third one is mindfulness. It's kind of combining all of them in meditation. And what that means, mindfulness means exactly is being present in the moment in a non-judgmental way. So it's like, I like to always say, like, I go outside and I just say, oh, curious, not a nice day, what a nice sun that's in the sky, I feel the breeze on my face, and it's curious how that feels. And you're just out there, you're not judging it, right? If it's pouring rain, I'm not like, oh, this day stinks. It's rainy, it's gray, it's cold. I'm just out there feeling the breeze on my face and appreciating what that feels like, the smells in the air, what I'm seeing, things like that. And so that's mindfulness. And what that does is it puts you into a lower sympathetic, lowers that overstimulation that we're living in, the fight or flight that we live in all the time. It lowers that and helps increase your parasympathetic. It's bringing that focus. And that is what the relaxation response that Dr. Herbert Benson had proved. It's anytime you bring your focus to one thing and one thing only, whatever that is, and your mind wanders, because that's what minds do. It's supposed to wander, and that's not bad, and it doesn't mean you're bad at it. But when it wanders, all you do is you bring it back to your focus. You say, okay, right back to my focus. And so you can use a number. You can, Dr. Herbert Benson started with the number 1. So he would have people just breathe in and breathe out and say 1, and breathe in and breathe out and say 1. Some people say count. Some people have mantras. You could say breathe in and breathe out, and have some gratitude, love, or, whatever speaks to you. You can just focus on your breath itself. You can just focus on, breathe in, breathe out, think nothing, keep it open, whatever you do. And when my mind is monkey mind and kind of crazy, then it helps me to have something to focus on, like a number or something in front of me that I look at, and I can just focus on the apple in front of me, and I just breathe in, breathe out, look at that apple. And then when my mind wanders, I bring it back to the apple. So you can, something to help you with monkey mind as you're learning. But what Dr. Herbert Benson has proved is that the more you it's the action of bringing yourself back and doing that increases your focus, your mindfulness, and that is what started lowering people's inflammatory reactions. So, and their inflammatory numbers, and help them feel better. And the more you do it, the improved you get. and they had more and more benefits with longer times. So that is what meditation in a nutshell. That's what that is. And mindfulness is a little bit different because it's just being present in the moment. So whatever you do, and so that's my third one, and that leads me right into my fourth one, which is being outdoors. So outdoors time counts for me as a full-on relaxing, and for so many reasons. So even on a rainy day, even on a cold day, I'm in New Hampshire right now, and it gets cold in winter, and it can be rainy sometimes. And I just bundle up, and I at least just walk outside, just to have my outdoor time. And so several things that happen. One, I'm usually mindful, right? I drop what I'm worried about and all my stressors inside, and I go outside and I just focus on being present in the moment and being, just appreciating the outdoor air, the coolness on my face, whatever it is. And so that's one thing that has a benefit. The second thing is if you can get even slightly in nature, get around trees, it actually changes your microbiome by being in nature. So it's called forest bathing, and there's science about this now, that just being in the forest, just walking on a trail, or even being by trees or flowers or anything nature. So, I grew up in Chicago, and so even then I would find little trails by my house in the Chicago suburbs, or when I was going to school out there, I would always find a little trail to get myself in nature. I'd go running past houses that had trees so I could still feel the power of nature. And that has been shown to be powerful for lowering stress hormones as well. And the third thing that can be beneficial is we know it changes your microbiome. So being in nature actually affects your microbiome, and it brings it into a calmer state. And the more beneficial bacteria that live there actually start to flourish a little bit more. So just being in nature. And one other thing it does is that it increases your it's called grounding. If you're by being on the grass, connects you with earth, and that then the ions, the negative ions that are in the earth, it's significantly higher when you're outdoors than when you're indoors, and that has been shown. And there's actually real data on this. We're energetic beings, whether everybody believes it or not. If you come into my ER and you have chest pain, I'm going to get an EKG of your heart. That is looking at your energy of your heart. If you're having seizures, we're going to hook up your brain and get an EEG, and that is looking at the brain, the waves, the electrical recordings in your brain, right? So this is now being proven more and more. And so things like being outdoors can actually help lower some of that sympathetic overdrive. It can change your vagus nerve, so the parasympathetic. It actually changes the hormones. It changes the microbiomes. It changes the metabolic products that they make, the postbiotics that go through our body. I mean, it's amazing how powerful it is. So I call it outdoor time, and I always ask my patient, every single person, if we're sick, if it's bad weather, if it's coronavirus, can you pop your head outside somewhere? Can we somehow get some outdoor time in every day? It's so beneficial. And then the last one, just to finish up with, are just whatever puts you in the zone. So if you love music, music can do this for you. Dancing can do this for you. Laughing, good laughter therapy. Oh my gosh, does laughter help? And in fact, I've been practicing laughter therapy myself, and it's awesome, like reading joke books and watching silly things at night. And it has helped me feel tremendously better. There's actually good data on that too, which can be hard because sometimes when you don't feel well, you don't feel like laughing. So there's so many different things that we can do. And this is where I work with people and help them figure out what will work for them and what they can get into their schedules. And those are some of the tools.
With the time outside and getting, the forest, what did you call it again? The
forest bathing.
Forest bathing.
It's really just walking outside in the woods.
I love that term though. Was there a certain amount of time, with vitamin D, we're 10, depending on your, skin tone and all that, is there a certain amount of time that's been shown? Like you need at least 20 minutes or an hour?
I'm not sure that I know that. I have a whole book on forest bathing, and I was reading some of the research. I'm not sure if I know how long it is. That's a really good question now. But I know from working with my patients, just anecdotally, when they go outside, for whatever people have, everybody reports feeling a little bit better coming inside. So I have people often, if they can, just walking to the end of the driveway at the sunrise or sunset. Of course, a lot of active people that are always outdoors. But even those little acts can turn people around and change their mood and help them feel refreshed and more hopeful, and start to feel, and people like me with joint pains, that can feel better too. So it has so many benefits. I'm not sure I know how long. That's a really good question. I'll look that up and get back to you.
And as far as the breathing technique, the one where you mentioned the longer expiration, the plateau, so the holding your breath, what is that, is it important to have that breath holding section or?
Well, it's been shown to kind of help with, I'm not entirely sure, and again, it's an old Ayurvedic thing, but the theory is that maybe it helps with switching some of the sympathetic to parasympathetic, or that it can be even more effective when they were doing that seemed to have more of a benefit. It's also been done for many years, so I'm not entirely sure, but that's how, yeah, it's in for 4, hold for 7, out for 8, and that there's quite a bit of data, not quite a bit, but there is some data with that shows that people who did that were able to tap into the vagus nerve more. So it also might be just that we keep doing it the way the study did it.
No, yeah, I was just curious. I've always heard of the breath techniques. I recommend that. And, that I always wonder if there's a reason for that, the actual sort of holding section. So asking for my own personal.
No, that's a really good question.
So we have a few more minutes. So just wanted to, ask you how you approach, I used to practice up in New York. And so stress or your crazy chaotic schedule is almost worn as like a badge of honor. People are like, I'm crazy busy. I have this is going, and my children and my, parents. And how do you sort of, let your patients know that it's okay not to have that, sort of side of your personality that, it's not sort of, helping. How do you, it's almost like an identity crisis, I would feel like, for most people. So
it's such a good point. You're exactly right about that, where people kind of wear it like a badge of honor, how busy they are. And some people are that busy. I mean, legitimately, right? And so, yeah, I think what's really important is what we've been talking about today when we start to talk about the effects of stress and what it's doing to our body, how it's eroding us, it's breaking us down, it's aging us faster. Stressed housewives compared to people who reported they weren't stressed has much shorter telomeres. It means they're going to live much less long because of that. So we have evidence now, good evidence now, that the amount of stress that we have affects our health significantly. And so when people are seeing me, I'm trying everything I can to get them to feel better, right? We're looking at a holistic approach, their whole body, not just the medical disease. They're not just an illness, not just what went wrong, not just one system of their body, their immune system or their gut. We're looking at them holistically. So I want them to understand that their thoughts affect their body and their body affect their thoughts. So some of their, anxiety or depression or negativity or whatever they're feeling is also from their guts. And so by getting in a good diet, we start changing the microbiome and the postbiotics, the materials that they make, the metabolites. And so that starts to change, and that starts to change the microbiome already, but it's not enough. So they could be eating all these wonderful plants and drinking green smoothies and doing all these good things for healing, but if they're having that stress still, it's not enough. So I help them understand that. And once they begin to see the connection and understand, it just starts simple. And I'm not going to change their whole life overnight. And so we start simple, maybe just add the breath work. They can choose what kind of breath work. And there's so many others. You can do the belly breathing, and there's so many different breath works. So I just told you my 2 favorites, but so we'll work on a breath work for 2 minutes a day and start with that. Or they can pick, for me, I have them pick 3 things a day that they would do. So maybe they would go outside for a few minutes. Maybe they'll do some breath work for me. Maybe they'll take a moment to be mindful twice a day, where they just are present in the moment instead of worrying about everything. Just be present in the moment, and maybe have some gratitude, maybe do some journaling, whatever they want to choose. So people will choose a few things that they're going to work on for me, and that's it. We'll send them out with that. But now they have an awareness. And so now they start to notice it. And that's where, when you ask me if all stress is good or all stress bad, it's not that stress is bad. It's the perception of stress, right? 2 people, there might be a terrible storm happening somewhere, and one person is so stressed out about it, and the other person's like, cool, look at this. This is awesome, right? And so the person who's stressed out about it, they're going to be having increased stress hormones, more sympathetic nervous system, fight or flight. they're going to have a suppressed gut, they're going to have a suppressed immune system, they're going to be shortening their telomeres and they're aging and increase their risk of chronic illness just because they're having those thoughts during the storm. Whereas the other person who's like, cool, this is awesome, I can't wait to watch it, I love watching storms, that person, their telomeres are good, nothing's being harmed, their stress is in a good place and it's fine. So the goal is, how can we change, right? How can we change our perception of stress? And that's what I want my patients to be. First, we become aware of it, and then we start to work on the tricks. And one of my favorite tricks, I have a whole bunch of them, but one of my favorites is just doing a timeout. So say timeout. Okay, this storm is coming. Oh my God, I'm so stressed out. We're having another storm. I can't believe it. I'm so worried. And so instead of that, say time out, take a breath away. I like actually physically say time out and kind of walk away from whatever's going on. I do some breaths. If I can get outside for a moment, just reset myself, right? So lower that sympathetic nervous system, lower those stress hormones, and quickly do some breath work to get my parasympathetic back in check. And you feel it wash over you. You can tell. And at that point, now I can make a better decision. Okay, storm is coming. What do I need to do? Do I need to board my windows? Do we need to move? Do we need to go somewhere? What are my important things I need to take? So I can now jump into something that I can do about it instead of just sit there worrying about the anxiety of what could possibly happen again. So that time out sometimes gives us that room to do that. So, and then you use some of these techniques that you're practicing. This is the time to pull them out. So that's what I do with my patients to kind of help.
Yeah, and I think that's such an important point that you made, that when you're in that spiral, that sympathetic, fight or flight mode, it's actually taking that, thought process away from that prefrontal cortex, or that part of our brain that is organizing and thinking and planning. And so, you kind of can't do both well. The brain can't have both firing
Right.
at the same time. So you're either in this emotional spiral or you're in this part of your brain that can plan.
Yeah, there's some really cool data on that. And one of them is that when people are having gratitude, they can't be firing in that anxiety, stress, worry mode, right? So I have been really practicing this with my patients and myself. Like we all do it together in like group almost. And when people come see me. And so when you're stressed out, you go to gratitude. What are you grateful for, right? I feel terrible today. This is a scary diagnosis. The storm is happening. All these bad things that are happening in the world right now. And what can you feel grateful for? What can you feel grateful for, right? Can you feel grateful for your dog, for your family member? Can you feel grateful that you got to wake up and you have air in your lungs right now, right? Other people, it was their last day today. It's not my last day today. I'm grateful, right? You can find something, like you have to find, I'm grateful I'm warm right now, that I'm not freezing cold. Anything you can come up with. 3 things of gratitude is what I recommend. And that can switch over pretty rapidly. You can no longer have worry for that little time where you're thinking of the gratitude. And the more you do it, the better you get. Your brain rewires and it goes towards the gratitude when something bad's happening, which is crazy because I started doing this now, like all these bad things, and everyone's like talking about it. I'm like, well, on the good hand, what's going on. I'm so grateful, and it's like I'm just automatically doing that now. And it works. It really works. So yeah, that's it. It's how amazing it is.
I love that. And, it's crazy, how medicine changes. We used to think the brain doesn't, you're stuck with the amount of neurons you have and they're either dying or that's all you got. But we know now differently, we can grow and actually grow parts of our brain. And I think, that speaks to that, gratitude side as well. You can create those new neural networks, and then they start to cement and get to be the way your brain starts to think more. And I think that's such a big part of it. So yeah, I love that. I love that you're, bringing that up to everyone's awareness.
And it's interesting, when I trained in medical school, and I don't know how long ago you trained, but when I trained, we were taught it was separate. It was like the brain, if someone had depression or anxiety or those types of mental health things, that was completely separate from the body and all whatever physiological thing was going on. We didn't even think about it. I would never have addressed it with gut issues or autoimmune issues or a heart attack. I would never ask about it. And now in the ER, oh my gosh, it almost seems 100% that people have a stressful event before they have a heart attack. Almost always. I see it over and over and over again. And I ask people now, maybe if they're stable enough to talk, or afterwards, what's going on in your life right before this happened? And, oh, I have a deadline, this, I had that, right? Whatever comes up. And so I have them right there in the ER working some breath work, and we're doing some of my favorite tricks. We're getting some music for them, and we're helping calm them down, which even that is improving to take away pain just by reducing their stress. So gosh, if we could teach everyone to help reduce our stress before we have that event, tremendous. So yeah, powerful.
Thank you so much. This has been so enlightening. Thank you so much, Dr. Miller, for taking time out of your busy, busy day to talk to us about all this. I think, putting this emphasis and making that awareness that the stress is such a big part of the healing process and treatment process, really, in breast cancer. And, by using this along with our other tools, including plant-based eating, it is just so, so important. Did you have any final thoughts you wanted to express for especially our breast cancer patients or family members of those going through breast cancer? Any sort of final thoughts?
I do. So for breast cancer patients, when I work with breast cancer patients, I help them build an integrative plan. And it's definitely more than just food, right? 100%. Like I said, we're holistic people. And I trained in integrative medicine, so holistic medicine, where it's everything. It's what we eat, it's what we think, it's how we live, it's our environment, it's how we sleep, it's the people that we're around, even now via Zoom. It's the amount of computers that we're in. It's all of this are linked, and it's a vital part of it. And so I urge everyone to explore it on whatever level, however it works for you, and it really helps people. Once you're sleeping better, once you've less pain, just to get over the hump and start to get better and better and heal. So yeah, and have fun with it. This is like the fun part of medicine, where relaxing and laughing and getting outdoors and letting go for a little bit. It's beautiful. It's a beautiful part of healing.
Well, thank you so much for all your wonderful advice and guidance. Is there a way, if you want to just mention again your website and how people can get in contact with you if they want to learn more?
Yeah, thank you. So I see patients, I do consults all across the United States. I'm in 20 different states right now. And our website is plantbasedtelehealth.com. And my personal website is eatandlivehealthfully.com. So you can find me at both of those, and I'll answer your emails or answer any questions. If you want to make an appointment, please do. Thank you.
Perfect. Thank you so much, Dr. Miller. This has been so amazing. I've enjoyed meeting you and talking with you today, and we hope we can talk soon.
Thank you, Roxanne. It's been my pleasure too.
All right. Have a wonderful day.
Bye.
Bye.